I don't know if this is necessary.
Y'all said you want to learn something about anatomy.
Well, yes, I did say that, but...
Y'all said you want to learn about the articulation, skeletal, muscle, body, and the like.
Enos, I'm frightened.
Do it.
Enos.
Do it!
Ow, you're hurting me.
Time to carve the pie.
Can I have some pie too?
Look, Enos, there must be some other way to do this. We don't have to kidnap people from the bus station.
Y'all got a cost-effective alternative, college boy?
Why don't we buy a videotape on anatomy?
That dog just might hunt.
The Standard Deviants present the anatomically correct world of anatomy with special guest Slim Goodbody.
Hi, my name is Galila Asrus, and welcome to the Anatomically Correct World of Anatomy Part 1. For the next couple of hours, we'll plunge into the world of human anatomy. We'll learn about our dependable friend, the skeletal system, our flexible friend, the muscular system, and our intricate but sometimes dangerously unpredictable friend, the nervous system. We'll even discuss common and rare bodily ailments. Basically, we want to help you learn this material and ace your tests.
Now we're dealing with some serious stuff. Memorization, diagrams, and in-depth exploration of the human body. But that doesn't mean we won't have time to relax. Oh yeah, it's just that exciting. You're also going to find some insert cards included with this video. These contain important diagrams and information you'll need if you expect to keep up with us.
My name is not Cliff. No one in this video is named Cliff. The writer is not nicknamed Cliff, and nobody's wearing black and yellow stripes. Hence, this video is not a replacement for going to class. Think of us as academic hamburger helper.
The material in this video will be presented to you in the order of the outline, which you'll find on your insert cards. Also, bear in mind that this is not a live presentation. We reside in the world of video.
That means you can view the tape at your own pace. You can pause the tape, rewind the tape, or even fast forward the tape if we cover material you already know.
Okay, now that all the preliminary junk is out of the way, let's get started.
When do we get to see naked people?
Soon enough, my gutter-minded friend. Soon enough.
Introduction, the language of anatomy.
If you're gonna be successful in the study of anatomy, you gotta be tough. And there are certain terms that are used over and over again that we have to beat into your head so you can succeed.
I'm Slim Goodbody.
I'm Slim Goodbody.
Goodbody.
Slim Goodbody.
I'm Slim Goodbody.
Hi, I'm Slim Goodbody, and I'm going to walk you through some of the terms you need to learn in order to understand anatomy. Anatomists have invented a special language that's really going to help us out as we chart our course through human anatomy. This language gives everyone who's familiar with it a universal understanding and a clarity when discussing the body, so we'll need to be really familiar with it.
For example, the word anatomy comes from the Greek words toumi, meaning to cut, and ana, meaning up, to cut up.
A lot of people use the term gross anatomy when studying the body. This is a specific type of anatomy. The term gross anatomy, contrary to popular belief, is not the study of boogies, puncture wounds, or the dad from Family Ties, but rather the study of bodily structures visible to the naked eye.
But since we're studying general anatomy, we're dealing with structures both visible and invisible to the naked eye. Because of this, it's important that you learn the terms that describe bodily orientation and direction. You want to be able to describe where certain parts of the body are located, and you also want to be able to understand us when we're describing where a structure is found relative to another one. So a firm grasp on these anatomical terms will help you get a handle on how to locate and identify different bodily structures. So the first term you'll want to memorize is anatomical position. This is the standard position we refer to when we describe the location of body parts. In this position, the subject is erect, feet together, with head and toes facing forward, arms at sides with palms facing forward. You'll also need to learn and memorize the terms that describe where body parts are located in relation to other body parts. You see, the human body can be divided into different sections. We do this by separating the body into distinct parts using imaginary planes. These planes are known as the transverse plane, the frontal plane, and the sagittal plane.
The transverse, or horizontal plane, runs from right to left and divides the body into superior and inferior sections. Superior means above or upper, and inferior means below or lower. So the head is superior to the neck.
The frontal plane lies vertically along the body from head to foot. This is the long axis of the body. The frontal plane cuts the body up into anterior and posterior parts. Anterior means front, and posterior means back. So your rear end is posterior to your belly button.
And finally, the sagittal plane lies vertically, and it divides the body into right and left sections. When dealing with this section, the terms medial and lateral come in handy. Medial means toward midline, or the inner side of, and lateral means away from the midline, or on the outer side of. So, the groin is medial to the thigh because it's on the inner side of the thigh, and the eye is lateral to the bridge of the nose because it's on the outer side of the bridge.
Two other useful terms are proximal, meaning nearer the trunk, and distal, meaning further from the trunk. The trunk in this case refers to the axis of the body from where most limbs spring. So the elbow is proximal to the wrist because the elbow is closer to the trunk, and the foot is distal to the leg because the foot is further from the trunk than the leg.
So there you have it. We've cut the body into different parts and given you the terms to help you navigate it. Memorize these and you'll be on your way. But remember, never really cut a body into sections unless it is stone cold dead.
Part 1. The skeletal system.
Now that you've learned a few basic anatomical terms, you're prepared to boldly explore one of the most important bodily systems, the durable, yet unexpectedly sensitive, skeletal system.
The skeletal system is a vast and a complex system that is home to more than 206 bones as well as cartilage. Cartilage is the bendable stuff found at the end of your nose, among other places. This bone and cartilage combo makes up 20% of the total mass of the human body. And like an athletic cup that doubles as a soup bowl, the skeletal system is multifunctional. Ow.
The skeletal system is designed to protect and support. That's its job, and it does it well.
The skeletal system as a whole can be broken down into two major divisions, the axial division and the appendicular division. The first part we'll look at is the axial division.
Section A, the mighty axial skeleton.
And now, an amusing fact from everybody's favorite anatomical educator, Slim Goodbody.
Did you know that the word skeleton comes from a Greek word meaning dried up body? Dried up bodies are fun!
The axial skeleton is composed of 80 bones and forms the long axis of the body that we mentioned before. This includes three major regions, the skull, the vertebral column, and the bony thorax.
Now, the axial division has an important job, namely supporting the head, neck, and torso, as well as protecting the brain, spinal cord, heart, and lungs. Without it, we'd be a gelatinous lump, unable to protect ourselves.
The skull is the most complex part of the axial skeleton, and also what we're looking at first. But before we do, it's probably a good idea for you to learn a few anatomical terms to help you understand the descriptions of bones in the axial skeleton. Two important terms to know are the terms paired and articulates.
The term paired usually means that a bone is paired with a copy of itself. In poker, you can have a pair of aces. In the skeletal system, you can have a pair of bones. For example, the temporal bones, two bones that help make up the sides of your skull, are paired bones. Obviously, the opposite of paired is unpaired. That's a bone that doesn't have a match.
The phrase articulates with is another way of saying connects with. So, for example, the radius and the ulna are two bones in your forearm that we'll talk about later. Both of these bones are connected to the humerus, a bone in your arm. So both the radius and the ulna articulate with the humerus.
So,
If one bone articulates with another bone, it's connected to it. Got it?
Ask me in an hour.
Will do. Let's move on to the skull.
Region 1, the skull.
The skull is made up of 22 different bones, not including the 3 tiny bones in each ear. The bones of the skull are divided into 2 sets, the cranial bones, or the bones of the cranium, and the facial bones.
The bones in the cranium.
The cranium is unbelievably important because it protects the ears and the brain like a bony helmet. It also serves as a point of attachment for muscles in the head that we'll discuss later.
The cranium contains 8 bones. 2 of them are paired and 4 of them unpaired. The 2 paired bones are the parietal and the temporal. That's 4 bones total. The 4 swing-in single bones are the frontal bone, the occipital bone, the ethmoid bone, and the sphenoid bone.
Altogether, that's 8 bones, and yes, you have to know them all. Thus, the memorization begins.
The frontal bone is the bone that forms the forehead and part of the eye sockets, or as smart people say, the superior orbits. The frontal bone also contains the paranasal sinuses, the mucus-lined cavities that warm up and filter air as we breathe it. If you're confused, don't worry. We'll give you more detail on the sinuses a little later on.
The paired parietal bones form the upper sides, or simply put, the roof of your cranium. The occipital bone forms the posterior base of the skull, at the back of your head. And let's not forget the paired temporal bones. These bones form the inferior lateral sides of the skull at your temples, just over your ears and below the parietal bones. Remember, inferior means lower, and lateral means outer side of. So the temporal form the lower outer side of your cranium.
Is that it? Can we see naked people now?
No. There are also 2 bones found at the anterior base of the cranium. These are the ethmoid bone and the sphenoid bone. The ethmoid bone helps form the nasal cavity and the nasal septum, a wall that separates the cavity into right and left sides.
Don't worry. We'll go into more detail on the nasal cavity in a little bit.
The sphenoid bone is located at the anterior or front part of the cranium's base. The sphenoid bone articulates or connects with all other cranial bones. Because of this, the sphenoid bone is sometimes called the keystone of the cranium, a nickname that gives it an inflated sense of self-importance.
One way to help remember the names of these bones is by breaking them up into ols and oids. The oid bones, ethmoid and sphenoid, are internal bones of the cranium. The ol bones, frontal, parietal, occipital, temporal, are all external cranial bones. Get it?
Yeah, time for nakedness. Woo!
Sorry, nakedness will have to wait until we finish talking about facial bones.
Naked facial bones?
Yes, I suppose the facial bones are naked.
All right!
There are 14 beautiful, beautiful facial bones. 6 of them are paired, and 2 are unpaired, for a grand total of 14 magnificent facial bones.
The facial bones are the unpaired mandible, the paired maxillae, the paired zygomatic bones, the paired nasal bones, the paired lacrimal bones, the paired palatine bones, the paired inferior nasal conchae, and the unpaired vomer.
These wonderful bones are directly connected to the facial muscles, which we'll talk about later. Those fantabulous facial bones also provide cavities for the facial organs like the eyes, nose, and tongue. But it doesn't stop there. The facial bones also anchor the teeth and even serve as pathways for air and food.
One of the most important facial bones is the mandible. The mandible forms the lower jaw and anchors the bottom teeth. It's the largest and strongest of all the facial bones.
Now, it's true the mandible is strong and works well for George Clooney and Jay Leno, but the paired maxilla are also important facial bones.
Paired maxillae anchor the upper teeth and form the upper jaw. They also form the anterior or front part of the hard palate. In everyday life, the hard palate is known as the roof of the mouth, but it doesn't stop there. The paired maxillae also form the inferior orbits. That's the lower part of the eye sockets. They even help form the nasal cavity.
Yes, that's right, the nasal cavity. The big hole where your sinuses and boogies live. Pretty impressive, huh?
Moving right along, other important facial bones are the paired zygomatic bones. These bones are the ones that form the cheekbones. Then there's the paired nasal bones. Without these babies, there'd be no bridge to your nose. And let's not forget the paired lacrimal bones. The lacrimal bones form the anterior medial orbits, which are part of the eye socket and, sadly enough, contain the lacrimal, or tear sacs.
I don't have any tear sacs. I'm a man.
Yes, you do, and please shut up.
Another important pair of facial bones are the palatine bones. You remember earlier when we said that the paired maxilla make up the hard palate? Well, they don't do it alone.
The paired palatine bones make up the posterior hard palate. That's the back part of the palate. The paired palatine bones also make up a small part of the floor of the orbits, or eye sockets. And finally, they help make up our friend the nasal cavity. That's inside your nose in case you've forgotten.
And then there's the unpaired vomer, yet another important facial bone.
The vomer forms the posterior and inferior parts of the nasal septum. That's the back lower part of the little wall that divides the inside of your nose.
Finally, there's the paired inferior or lower nasal conchae. The paired nasal conchae make up the lateral or side walls of the nasal cavities. You got it?
I remember bones.
That was a lot of information. So now might be a good time to...
Find yourself an old tractor tire and throw it off a bridge.
No. What I was going to say was that now might be a good time to rewind the tape and review what you've just learned.
Oh, right, the hyoid bone. There's also a hyoid bone, which isn't officially part of the skull, but is often discussed at the same time.
The hyoid bone is a small horseshoe-shaped bone. It's located inferior to, or below, the mandible, and it's superior to the larynx, or voice box, in the anterior neck. Whew, that was a mouthful. The hyoid bone serves as a point of attachment for a bunch of neck and tongue muscles. It also acts as a movable base for the tongue. It even raises and lowers the voice box during swallowing and speaking.
The hyoid bone is a unique, almost sad bone. It's the only bone that doesn't connect directly with any other bone in the body. Now, I believe this principle is best illustrated in a song I wrote, One Lonely Evening at Home. Thank you. The hyoid bone is a lonely, lonely bone, ladies and gentlemen. Standing alone now, the hyoid bone.
Region 2, the vertebral column.
The vertebral column, or as it is known in dumb guy circles, the spine, consists of 26 different bones called vertebrae. The vertebrae are separated by pads of fibrous cartilage called intervertebral discs, which absorb pressure and allow for maximum flexibility. The vertebrae are held together and stabilized by types of connective tissue called ligaments and tendons. Ligaments attach bones to bones, and tendons attach bones to muscles. But don't worry, we'll elaborate on tendons and ligaments in a bit. The vertebral column houses and protects the spinal cord, another structure we'll give you the details on later.
And now, another amusing fact from the man with the anatomical plan, Slim Goodbody.
Did you know that the adult spine is 28 inches long, and if ripped out, can be played like a glockenspiel? Glockenspiels are fun!
The vertebral column is separated into 5 different divisions. They are the cervical division, the thoracic division, the lumbar division, the sacral division, and the coccygeal division.
The cervical division contains 7 small vertebrae which are located in the neck. The thoracic division contains 12 vertebrae which are located in the torso. These vertebrae articulate or connect with the ribs. The lumbar division contains 5 vertebrae which are located in the lower back.
To remember the number of vertebrae in these first 3 sections, think of the times most normal people eat breakfast, lunch, and dinner, 7 a.m., noon, and 5 p.m. Think of the cervical division as the breakfast division, with 7 vertebrae. The thoracic is lunch, with 12, and the lumbar is dinner, with 5 vertebrae. Pretty helpful, huh?
Okay, the sacral division, or the sacrum, contains 5 vertebrae. These vertebrae are fused or melded together into one big vertebrae in adults. It's inferior to, or below, the lumbar vertebrae. The coccyx located inferior to the sacrum, contains 3 fused vertebrae. It is sometimes called the tailbone, or as it is known in elite dumb guy circles, the butt bone.
The vertebral column also contains 4 curvatures which give it an S shape and a super spring-like flexibility.
The top curvature in the vertebral column is called the cervical curvature. This curvature is concave posteriorly, meaning it caves inward like a spoon. It is located in what we call the neck. The thoracic curvature is convex posteriorly, meaning it bulges outward like an eyeglass lens. This curvature is located in the upper backbone. The lumbar curvature is also concave posteriorly, but this curve isn't formed until we begin to walk upright. This curvature marks the lower backbone. And finally, the sacral curvature is convex posteriorly. Put simply, it's located in the butt.
These curvatures give our spines an attractive S shape that men and women adore both at home and abroad. But as with all things good, curvatures have a downside, namely curvature abnormalities.
Curvature abnormalities can be blamed on any number of factors. Some are congenital, which means that they were present before birth. Some are disease-related. Some are even caused by bad posture. There are a few common curvature abnormalities like scoliosis, kyphosis, and lordosis.
Scoliosis, for instance, is an abnormal curvature that usually occurs in the thoracic region of the spine. That's the second region that forms the upper backbone. For some unknown reason, scoliosis is more common in girls and can sometimes be caused by having lower limbs of unequal length. Scoliosis can sometimes be treated surgically or with a body brace. Kyphosis is an extreme thoracic curvature, creating a condition known as hunchback and inspiring lackluster animated films. You can get this disease from rickets and tuberculosis of the spine. Lordosis is an extreme lumbar curvature and is commonly referred to as swayback. Lordosis sometimes affects pregnant women and individuals with potbellies. This is because people with potbellies have a tendency to thrust their abdomens forward.
You know what? I'm gonna thrust my abdomen forward.
Go! Well, that's the vertebral column and all of its trappings. We've also discussed the skull. That leads us to the final part of the axial skeleton, the bony thorax. Now, the bony thorax may sound like a mythological...
I am the bony thorax. Beware the vengeance of the false ribs. You must
You're
go...
not the bony thorax. You're just a guy in a cloak.
Am I? Or is your mind numb with fear?
Well, don't I feel foolish?
Region 3, the bony thorax.
The bony thorax, or the thoracic rib cage, protects the heart and the lungs. It serves as a point of attachment for the neck, head, back, chest, and shoulder muscles. The bony thorax is made up of 3 parts. They are the 12 thoracic vertebrae, the sternum, and the ribs.
The thoracic vertebrae form the posterior midline of the rib cage. That means they divide the rib cage in half from the backside. The sternum, or the breastbone, forms the anterior midline of the cage. It's easy to find the sternum. It's the hard plate right in the middle of your chest. And finally, the ribs are 12 paired flat bones that form the lateral or sidebars of the cage. That means altogether there's 24 ribs. The ribs are all directly attached to the thoracic vertebrae, but not the sternum.
The first 7 ribs are called the true ribs. The true ribs are attached anteriorly to the sternum by hyaline cartilage, a special type of cartilage. And they are, of course, as stalwart and honest as Abe Lincoln. The last 5 ribs are known as false ribs. The false ribs are indirectly attached to the sternum by cartilage located directly above them. They are also as wily and dishonest as the pickpockets from the musical Oliver. The last 2 false ribs are sometimes called floating ribs because they have no attachment, physical or emotional, to the sternum. Instead, they are attached to muscles in the lateral wall of the body.
And remember, the ribs are paired bones, so there's 24 altogether.
Well, that about sums it up for all 3 parts of the axial skeleton, the skull, vertebral column, and the bony thorax. And if you can't remember all the names and characteristics of the bones we've discussed, feel free to fail your test. Oh, I'm sorry, I didn't mean to say that. Feel free to rewind the tape and review at your own pace. But brace yourself, because there's more to the skeletal system than just the axial skeleton. Prepare to confront and conquer the appendicular skeleton.
Section B, the appendicular skeleton.
While the axial skeleton protects the brain, heart and lungs, and spinal cord, the appendicular skeleton helps us move. The appendicular skeleton is made up of the upper and lower limbs. We usually call them arms and legs. It's also made up of the girdles of these limbs. The girdles attach the limbs to the axial skeleton. All the bones in the appendicular skeleton help us move and allow us to manipulate our environment.
Also, bear in mind that when we're talking about the appendicular skeleton, we're talking about duplicates. The bones of the legs, arms, girdles all have duplicates on the other side of the body. This is known as bilateral symmetry.
Region 1, upper limbs.
One of the many important bones contained in the appendicular skeleton is the pectoral girdle. The pectoral girdle is also called the shoulder girdle. So remember, even though we're only describing one pectoral girdle, there are two in your body because you have two shoulders.
The pectoral girdle attaches the upper limb to the trunk of the body and also anchors muscles that move the limb. Each girdle is made up of two bones, the clavicle and the scapula. The clavicle, or collarbone, is the anterior bone. The scapula, or shoulder blade, is the posterior bone.
You have 30 bones in each upper limb, each one of them useful, each one of them special in its own way. Why, without the 27 bones of your hand, you'd never be able to play an exciting game of skee-ball. And without the humerus, the radius, and the ulna, you'd never be able to carry home those exciting prizes you won playing skee-ball. Exciting prizes like whoopee cushions and decorative magnets.
I don't play skee-ball.
Well, you should. It's exciting, but not half as exciting as an in-depth discussion of the bones in our upper limbs.
As we said before, each of your upper limbs contains 30 bones, broken down into 3 parts: the arm, the forearm, and the hand. And these 3 regions can be broken down into individual bones. So let us now take advantage of the knowledge and experience of our elders as we turn to the Old Person's Learning Annex to learn about bones in the upper limbs.
It's the Old Person's Learning Annex, where we learn from the wisdom of our elders.
They say that the upper arm contains one bone, the humerus. It is the largest and longest bone in the upper limbs. Well, I will tell you, I do not find a lot of humor in this bone. It is not a funny bone. It is not funny at all. You see, the knee, that is a funny bone. You get hit in the knee and it goes ugh, and you go oi, and you kick, and it's a funny thing. The humerus, it is very painful. I'll tell you why. 1942, I was stationed in Burma, Indochina. And I was there, and I was sitting there, and I was whittling, as I would often do in the course of the day, to pass the time. Well, a man from my platoon, another soldier, if you will, he took his gun, and he fired a bullet right into my humerus, and it was very, very painful, and I did not enjoy that one bit at all. I don't remember his name. It was Lenny. It was Ifkis. It was something. It was stupid. Anyway, what I'm telling you is that the war itself, it was not so bad. It was like MASH, just more serious.
The upper arm contains only a single bone, the humerus, whereas the forearm contains the radius and the ulna. The proximal ends of the radius and ulna, that's the ends closer to the trunk of the body, those ends connect with the humerus to form the elbow. Their distal ends, you know, the ends further from the trunk, they connect with the hand to form the wrist.
And now, the Old Person's Learning Annex, where long-winded stories serve us well.
I remember when my son Herb broke all 27 bones in his hand. I remember it like it was yesterday. He was 4. He's 32 now, and he's an accountant. He's so very, very good. We're very, very proud of him. Anyway, Herb was out playing carpenter with his cousin Murray. Most boys play army, but they were playing carpenter. Herbie's so cute. He's so smart and imaginative. Anyway, Murray, being the cute little idiot that he is, he took a ball-peen hammer and smashed Herb's hand. That's right. He broke all 8 carpals, all 5 metacarpals. Those are the 5 long bones that form the palm. And he broke all 14 phalanges. That's the fingers in the thumb. It's terrible. Herb taught me all that stuff, though. I'm very, very proud of him. Did I mention that he's an accountant now in New York?
So the hand is made up of 8 carpals, 5 metacarpals, and 14 phalanges. The 8 carpals are the bones that form the wrist, where we put our watches and bracelets. The 5 metacarpals make up the palm, and the 14 phalanges give us our fingers and a pollex, which is a fancy word for thumb.
There's the shoulder girdle, made up of the clavicle and scapula. And then there's the humerus, ulna, radius, 8 carpals, 5 metacarpals, 14 phalanges, and a whole lot of love.
And that's it for the upper limbs of the appendicular skeleton.
Region 2, lower limbs.
Now, some might argue that the body's lower limbs are more important than its upper limbs. These guys, for instance.
The lower limbs are far more important than the upper limbs.
No, they're not.
I'll get you like a fire!
Well, regardless of which set of limbs is more important, the pelvic girdle is the cornerstone of all lower limbs. You probably know the pelvic girdle as the hip, but you probably don't know it personally, so let us explain. The pelvic girdle attaches the lower limbs to the trunk of the body. It's also a point of attachment for the muscles that move the lower limbs, and it even protects sensitive organs like the urinary bladder.
The pelvic girdle is made up of 2 bones called os coxae, which connect posteriorly with the sacrum and the coccyx. You remember the sacrum. It's a division of the vertebral column. Each os coxa is made up of 3 bones, the ilium, the pubis, and the ischium.
The ilium forms the major superior or upper section of the os coxa, or where you rest your hands on your hips when you're preparing for a big cowboy gunfight.
The pubis forms the anterior and inferior, or lower front, section.
And finally, the ischium forms the posterior and inferior portion of the os coxa. This ischium is the bone you sit on when you sit.
The pubic arch is another important area in the pelvic girdle. The pubic arch, or the area... the pubic arch... Okay, let's get all the pubic jokes out of the way right now.
Pubic arch? What is that? Like a big yellow arch with hair on it? You know, like the fast food chain, but with hair on it? Hair on it?
Hey, look at me. I'm a big pubic arch.
Pubic! All right, I'm done.
Good.
Now the pubic arch is the angle between 2 pubic bones. It is inferior to the pubic symphysis, a joint that connects the 2 pubic bones. But don't worry about joints now. We'll talk about them later.
The pubic arch can be used to identify a person's sex. This is because the angle of the pubic arch in males is less than 60 degrees, and the angle in females is greater than 80 degrees. The pubic arch has a wider range in females.
Can that same angle be used to uncover secrets about a person's sex life?
No.
How can you do that then?
Well, it's not actually related to the subject matter, but to investigate a person's sex life, one can examine their personal habits. If a person wears sunglasses regularly and uses the word dude, you can bet they have a healthy sex life. If they tend to wear tapered pants, play role-playing games, and discuss the lower limbs of the body, they're probably pretty hard up. Now, all the pubic girdle details aside, let's discuss the lower limbs, dude.
The lower limbs each contain 29 bones.
That's a lot of bones!
The lower limbs support the entire weight of an erect body. They have to be much stronger than the upper limbs so we can use them for jumping, running, walking, and devastating karate moves.
I told you they were more important. You self-righteous son of a bee! I'll kill you! That's what I'll do!
The lower limbs are separated into 3 regions: the thigh, the leg, and the foot.
The only bone in the thigh is the femur, which is the largest, longest, and strongest bone in the body.
The leg is made up of the tibia or shin bone and the fibula. Only the tibia bears the weight of the body, which is transmitted from the femur to the foot. The proximal end of the tibia or top part articulates with the femur to form the knee joint, which is protected by the knee cap or patella. The distal or lower end of both the tibia and fibula connect with the foot to form the ankle.
Notice any similarities? The femur is like the humerus of the arm, both long, both durable. The tibia and fibula are like the lower limb versions of the radius and ulna, and the ankle is like the wrist.
Next up, the foot contains 26 bones in 3 different regions. Those regions are the tarsals, the metatarsals, and the phalanges.
The tarsals are 7 bones that form the ankle. The metatarsals are 5 bones that form the arch of the foot. Finally, the phalanges are 14 long bones that form the toes. There are 3 bones in each of the 4 little toes and 2 in the big toe, or some call it the hallux.
And that's it for the lower limbs. As you can see, the realm of lower limbs is a magical and exciting territory. A territory whose magic, I believe, can only truly be captured in song. The femur is a tough bone, ladies and germs, a tough bone indeed. Femur in the corner of my thigh, dark gray colored femur.
Section C, articulations.
Articulation is a fancy word for joint. Joints are sites where bones join together to make movement possible. Without joints, we'd be unable to run, do push-ups, or enjoy the musical stylings of the Grateful Dead. Now, joints can be described and classified in 2 different ways. They can be described functionally, or they can be described structurally.
Joints are divided into 3 different functional classifications based on the degree of movement they allow. These classifications are synarthrosis, amphiarthrosis, and diarthrosis.
Synarthroses refer to joints that are immovable. Synarthrotic joints just won't budge. They just lock bones together. These types of joints are found in places like the cranium.
The classification amphiarthroses refer to joints that are slightly movable. They're not rambunctious or hyper, but they do move a little bit. These joints are found in places like the vertebral column.
And last, but by no means least, the classification diarthroses refers to freely movable joints. These are the types of joints found in upper and lower limbs.
In addition to all this, joints can also be classified by their structure. The 3 structural joint classifications are fibrous joints, cartilaginous joints, and synovial joints.
The first structural joint we'll talk about is the fibrous joint. Some joints have little fluid-filled spaces between bones. These little fluid-filled spaces are called joint cavities. Fibrous joints do not have joint cavities. Fibrous joints are joints where bones are united by fibers of fibrous tissue at their joint sites. Fibers. Fibers. Hey, it's fun to say fibers. One specific type of fibrous joint is called a suture.
Now everyone has sutures in his or her skull. These sutures are made up of interlocking or overlapping bone edges that are connected by short fibrous fibers. The term fibrous fibers may sound redundant, but hopefully it'll make you remember the name of the fibrous joint. 2 other types of fibrous joints are syndesmoses and gomphoses.
In syndesmoses, bones are connected at their joint sites by long fibrous cords or sheets. Fibrous, get it? You can find an example of this joint in the lower leg between the tibia and the fibula.
Another cool fibrous joint is the gomphosis. Gomphoses are the joints that connect the teeth to their tiny bony sockets in the jaw. They are attached with fibrous periodontal ligaments.
Are you catching a trend here? Fibrous joints use fibers. Another type of structural joint classification is the cartilaginous joint. Now, can you guess what substance connects bone to bone in a cartilaginous joint?
Gum?
No, but thanks for embarrassing yourself.
Cartilaginous joints are joints where bones are connected by plates of cartilage. Like the fibrous joint, the cartilaginous joint has no joint cavity. They are amphiarthrotic or slightly movable and are usually found in the axial skeleton.
You remember the axial skeleton. It's the skull, the vertebral column, the ribs. Yeah, you remember it. Well, a good example of a cartilaginous joint would be symphyses.
Symphyses are flat, frisbee-like discs of cartilage between the vertebrae. The proper name for these frisbees is intervertebral discs. Symphyses are also found between the vertebrae and in the pubic symphysis of the pelvic girdle.
The synchondroses are another fine example of cartilaginous joints. The synchondroses are joints made up of superflexible cartilage called hyaline cartilage. These joints can be found in structures called epiphyseal plates. Epiphyseal plates are found in long bones like the humerus and the femur. These plates allow for linear bone growth in places like your arms and legs. That's longitudinal growth.
Get it? The final structural classification is the synovial joint. These joints consist of bone ends that are separated by a joint cavity filled with synovial fluid. Synovial fluid is a liquid that reduces friction between bones. Synovial joints come in 6 exciting varieties: gliding, hinge, pivot, ball and socket, saddle, and condyloid.
The gliding or plane joint has a flat surface and allows for sliding movement in between bones. The gliding joints are found between ribs and vertebrae and in the joints of the wrists and ankles. The joints in the wrists and ankles are known as the intercarpals and intertarsals. Makes sense, doesn't it?
The hinge joint, found in the elbow and knee, is made up of the convex end of one bone that fits into a concave groove of another bone. Remember, convex bulges out and concave caves in. The hinge joint kind of works like the mechanical hinge you might find on a door. The pivot joint is another important joint. It has a rounded surface that protrudes into a ring formed by a bone and ligament.
Pivot joints are found between your first and second cervical vertebrae, called the atlas and the axis. Remember, your cervical vertebrae are located in your neck, and the pivot joint is the joint that allows you to shake your head no.
So, without the pivot joint, we'd be unable to say no to drugs, shake our heads in disgust at Andy Capp, or deny sex to your neighbor.
The next major joint is the saddle joint. The saddle joint is found in the thumb and, oddly enough, looks kind of like a saddle. The saddle joint allows for both up and down and side-to-side movement. This enables us to thumb rides from serial killers, thumb wrestle, and critique films.
You can find the ball and socket joint in both the shoulder and hip. It consists of a large spherical head that fits into a large concave cavity and allows for all types of movement, making it the most mobile joint. In fact, you remember the 3 functional classifications of joints? Synarthroses, amphiarthroses, and diarthroses? Well, the ball and socket joint is a diarthrotic joint because it's super mobile.
Finally, the condyloid joint, located in the knuckles and wrists, consists of a small condyle, or projection, that fits into a small depression and allows for side-to-side and up-and-down movement.
Well, there you have it. You are now a joint scholar. You know about the 3 functional classifications of joints, as well as the 3 structural classifications.
You now understand the carefree, wonderful, no-strings-attached world of joints. Free of worry, free of violence, free of religious guilt, free of pain.
Joint injuries, joint disorders.
When studying joints in the human body, it is very important to take into account common yet very painful injuries. These include sprains and dislocations.
A sprain involves the stretching or tearing of a ligament, which unites bones at a joint. A sprain is extremely painful. Sprains can be partial tears or complete tears.
Partial tears heal very slowly because of lack of blood flow to ligaments. Complete tears must be repaired surgically, and surgery is very frightening, even if you can bench press your own weight.
Often, when a ligament is completely torn in athletes, it must be replaced with a ligament from another region, an artificial ligament, or a ligament from a cadaver.
That means dead guy. Having a piece of dead guy inside you is very frightening, even if you can body slam a steel girder. Dislocations are also very painful.
When a dislocation occurs, bones are forced out of their normal position at a joint site.
Dislocation often occurs in shoulders, fingers, and thumbs. I have dislocated all 3. I am in constant pain. Dislocations are corrected by placing the bone in its proper position, a process that is very painful and very frightening.
Joint injuries are painful, but joint disorders are often prolonged and more serious. Arthritis is an example of a serious joint disorder.
Arthritis is a general term that refers to over 100 different kinds of inflammatory diseases. There are 3 common kinds of arthritis: osteoarthritis, rheumatoid arthritis, and gout.
Osteoarthritis is the most common condition. You remember cartilage, the flexible material found in joints and other places? Well, with osteoarthritis, cartilage is destroyed. When this happens, little chips of bone called bone spurs form, making movement extremely difficult. This makes easy tasks, like getting up from a chair, difficult and painful.
Rheumatoid arthritis is another form of arthritis. It causes destruction of cartilage, fusing bone ends together so joints can't move anymore. You can imagine how painful that might feel.
Finally, Gout is a disease that's caused by a buildup of uric acid in joints. Uric acid is a natural bodily secretion, but in excess it can lead to the melding together and immobilization of joints. The most common joint affected by gout is the hallux, or big toe. Gout can be prevented by avoiding foods containing the nucleic acid purine, like liver.
Well, it shouldn't be that hard to avoid liver.
Damn! Sadly enough, we've come to the end of our journey through the skeletal system. You've learned about the axial and appendicular skeleton and familiarized yourself with the joints in those systems. Remember, if you're uncertain about any terms, feel free to cheat off your neighbor's exam. But if you're like me and are in constant fear of brutal retribution in the afterlife, just rewind the tape. Yeah, that's right. Rewind. Rewinding is a very precious tool. Precious indeed. Rewind. Be kind. No, please. No more tackling.
I actually like that song.
You do?
Yeah.
Let's get skeletal. Whoa.
Those guys hate any and all music.
The muscular system.
Hey, thanks, CJ. I'll make sure this gets folded in a jiff. Right. Hi, my name's Will. I'm the towel boy at the Neighborhood Health and Fitness Center. My duties include folding towels and also making sure towels get folded. They gave me a novelty t-shirt. It says Fold King. Sometimes I wear it to the park. And I'll tell you, working in a place like this, you can sure learn a lot about muscles. Huh? I mean, sure, there's 3 different types of muscles: cardiac, smooth, and skeletal. And skeletal's the only type you can see, but what you can see? Oh, pretty impressive. Hey, thanks, Rex. Fold King's on the job. Right, okay. Oh, my God. Oh, hey, oh, that's pretty funny.
Section A, Introduction to Muscles.
There are 3 fundamental types of muscle tissue: cardiac, smooth, and skeletal. Cardiac muscle forms the walls of the heart and contracts to propel blood through the blood vessels of the body. Cardiac muscles are involuntary. Involuntary muscles are muscles we have no conscious control over. Cardiac muscles are striated, which means the muscle tissue has obvious stripes, or striations. We won't really get into cardiac muscle until we discuss the circulatory system in the anatomically correct world of anatomy, Part 2.
Smooth muscle forms the walls of hollow structures, like the digestive tract. It's also responsible for changing the diameter of these tubes to move stuff like food through them. Smooth muscle is controlled by the autonomic nervous system, which we'll talk about later. Basically, this means that smooth muscle works without any conscious help from us. It's on autopilot.
Smooth muscle cells are unstriated. That means they don't have the stripes that cardiac and skeletal muscles have. But, like cardiac muscles, smooth muscles are involuntary. We can't control them consciously.
Section B, Skeletal Muscles.
Skeletal muscles, the final division, are typically attached to the skeletal system, hence the clever name, skeletal muscles. These muscles are the most plentiful and their names are hard to memorize, so we're going to focus on them for a while.
The skeletal muscles are also responsible for body movements and facial expressions. Throwing balls, running from the police, frowning in disgust, all these things are the bread and butter of skeletal muscles. Skeletal muscle cells are elongated, striated, and under voluntary control.
So when you think skeletal muscles, think striated and voluntary.
Apart from movement, skeletal muscles have a number of other responsibilities. Skeletal muscles help you stand. They maintain posture by resisting the pull of gravity.
Nothing can resist the downward pull of gravity. Just watch. Hup! It's impossible, I tell you. Impossible!
I appreciate and understand your concern, insane man, but the skeletal muscles actually can do it. They can also adjust themselves to stabilize joints and even generate heat during muscle activity.
Heat? By God, where can I get me some skeletal muscles?
You already have over 600 of them. Isn't that wonderful?
But there is one catch. You see, skeletal muscles are named using 7 different naming criteria. Within each muscle's name, there are certain descriptions that characterize the muscle. These naming criteria are location, shape, relative size, direction of fibers, number of origins, origin and insertion, and lastly, action. Knowing these naming criteria will help you identify muscles more easily on an exam, or help you understand more about individual muscles when you hear their names.
Location refers to the bone or bones that are directly associated with a muscle. For instance, the temporalis and frontalis muscles are named for the cranial bones underneath them. The temporalis is above the temporal bone, and the frontalis is above the frontal bones. Piece of cake.
Shape describes a muscle's approximate shape. For example, the deltoid muscle is triangular. In case you don't know, delta is a Greek symbol shaped like a triangle. And the trapezius, another muscle, is in the shape of a trapezoid. Simple, isn't it?
Another way to classify muscles is through relative size.
For example, the terms maximus and major refer to the largest group of muscles. On the other side of the coin, the terms minimus and minor refer to the smallest group of muscles. Longus and brevis are two other muscle terms that describe size. The term longus refers to the longest muscle in a muscle section, and the term brevis describes the shortest.
Size is everything, big guy. Relative size.
You get the point? Muscles can be classified by their size, too. Another way to classify a muscle is by its direction of fibers.
The direction of fibers describes the orientation of muscles relative to the long axis of the body. The long axis of the body runs from head to toe, so muscles can be rectus, meaning straight. In this case, they're flush with the long axis. Muscles can be transversus, meaning across. This means they're perpendicular to the long axis of the body. Or, muscles can be oblique, meaning they're oriented at an angle to the long axis. It's as simple as that. Rectus straight, transversus across, oblique, angle.
The number of origins refers to the number of attachments a muscle has to bone via tendons.
For example, the biceps have 2 attachments to bone in the forearm, the triceps have 3 attachments, and the quadriceps 4 attachments.
Next up, origin and insertion.
The origin and insertion of a muscle describes its attachment to bones. Origin describes a muscle's attachment to immovable bone, and insertion describes its attachment to movable bone. Take the sternocleidomastoid muscle. This muscle originates from the sternum and clavicle. In simple terms, that's the beginning of the muscle. But the sternocleidomastoid eventually inserts itself on a part of the temporal bone called the mastoid process. We get sterno from sternum and cleido from clavicle. Then we get mastoid from mastoid process.
Put it all together? Sternocleidomastoid. It's like a puzzle for science lovers.
The next muscle classification is action, which indicates the type of movement a muscle creates.
For example, the flexor muscle decreases the angle between bones, like when you're lifting up a dumbbell. The flexor flexes. The extensor increases the angle between 2 bones, like when you're bringing that dumbbell down. The extensor extends.
And that's the 7 criteria for naming muscles: location, shape, relative size, direction of fibers, number of origins, origin and insertion, and action. Now, not all muscles use these 7 criteria in their names. They'd be way too long. But there are some muscles that are described using a number of them. So it's a good idea for you to be familiar with them all. A good way to remember all these ways to classify muscles is by using the phrase lad snore. You see, each letter in this word is the beginning letter of a term used to describe muscle orientation and location. Commit it to your memory, lad snore. A little English boy who can't sleep quietly.
I wish I could stop snoring.
Hey, 'tis true, the lads snore.
I'm also a narcoleptic.
Being familiar with all 7 muscle naming criteria does make it easier to identify the skeletal muscles. So, with that in mind, let's take a long, hard look at the skeletal muscles.
The skeletal muscles.
Hi, my name is Sean, and I'm going to walk you through some of the uses and names of a whole bunch of skeletal muscles. I'm not going to lie to you, there's going to be a whole hell of a lot of muscle names to memorize. Now, considering most of us have no exposure to muscles outside of the times Popeye the Sailor Man made battleships appear in his upper arm, this is going to be a challenging task. Just never lose sight of the fact that you can rewind and review whenever you feel the need to.
But what if my remote has been
smashed by some sort of hard blood instrument? Well then, I guess you'll have to pay extra close attention. But that won't be hard, because we've got renowned educator and international megastar Slim Goodbody to help us learn about muscles. Why don't you come on out, Slim?
Hello.
Hey! All right! Are you ready to learn?
Oh, yeah, I guess so.
I wasn't talking to you, but that's okay. Let's learn!
Muscles of the head.
Let's start off with the muscles of the head. Head muscles are usually broken up into two groups, those that manipulate our facial expressions and those that help us chew and move our tongue. The muscles that control facial expressions are those of the scalp and face. These muscles are unique because they're the only skeletal muscles that are attached to skin and other muscles as well as bone. And Slim Goodbody has kindly agreed to help us demonstrate the use of tongue and facial muscles by allowing me to tie this rope to his tongue and drag him about the room.
I never agreed to that.
Oh, come on, Slim, do it for the kids.
I'm not going to let you tie a rope around my tongue and drag me around the room.
The main muscle of the scalp is the epicranius, which is made up of the frontalis and the occipitalis. Important muscles of the face are the orbicularis oculi, zygomaticus, risorius, orbicularis oris, and the buccinator. It's easy to remember the muscles containing the prefix orbit because it should remind you of the orbitals in the cranium.
The three important muscle pairs connected with mastication or chewing are the masseter, temporalis, and pterygoids. The muscles that move the tongue when we speak and eat are the intrinsic muscles. The intrinsic muscles change the shape of the tongue itself. The extrinsic muscles are also important to the tongue because they anchor and move the tongue around inside of the mouth.
Now look, I'll just make it a soft knot.
No, listen, you tie the rope around your tongue, huh?
I'm not the guy with the suit. Now let's look at the muscles of the anterior neck and throat. These muscles help us swallow. Our friend Slim Goodbody has agreed to demonstrate the use of the throat muscles by swallowing a tennis ball with a nail sticking out of it.
What, a normal tennis ball isn't enough?
Slim, please.
The muscles of the anterior neck and throat include a bunch of muscles that attach to the hyoid bone. These include the suprahyoid muscles and the infrahyoid muscles. Behind all these muscles that move the hyoid and voice box is the pharyngeal constrictor muscle of the pharynx. This muscle helps us swallow.
No.
Do it.
No.
Do it.
No.
Do it.
There's a nail sticking out of it.
Other muscles of the neck are responsible for movement of the head and body trunk. Slim Goodbody will demonstrate the muscular movement of the head by driving this car
Hey, I can do that.
straight into a reinforced steel wall.
Hey!
The muscles responsible for moving the head and neck are the sternocleidomastoid, scalenes, splenius, and semispinalis. The trapezius muscles of the back also help move the neck and head, but we'll cover them in more detail later on. The muscles that help move the trunk of the body are the erector spinae, the semispinalis, and the quadratus lumborum.
Look, whoever nicknamed you Slim Stunt Body didn't know what he was talking about.
No one named me that.
Ooh, pinched a nerve. Oh, shit. The deep muscles of the thorax help us breathe, plain and simple. Now let's watch Slim Goodbody inhale a tank of water.
You're insane.
The deep muscles of the thorax are easy to remember. They're located around the thoracic cavity. They are the external intercostals, the internal intercostals, and the diaphragm.
The water's been purified. I don't care. Now, most people believe that the superficial muscles of the thorax are the same as the deep thoracic muscles, except that they date cheerleaders and enjoy teen magazines. Now, this is not true. The superficial muscles of the thorax actually act on the scapula to create arm movement, like pushing or punching. Watch Slim Goodbody as he uses his superficial thorax muscles to fight this man-sized boxing cow.
You come up with things like this yourself?
The superficial muscles of the thorax are the pectoralis major, the pectoralis minor, the serratus anterior, the subclavius, the trapezius, the rhomboids, and the levator scapulae.
Will you stop it?
The muscles of the abdominal wall control the movement of the body's torso and provide protection for internal organs. When the abdominal muscles contract, the pressure within the abdomen increases. Well, this helps us to sneeze, vomit, cough, scream, give birth, burp, and blow our noses. Hello.
Don't even think about it.
The muscles of the abdominal wall are the rectus abdominis, the external oblique, internal oblique, and the transversus abdominis.
I wasn't gonna ask you to vomit. Much. Next up are the muscles of the pectoral girdle. The muscles of the pectoral girdle move the arm by directly acting on the humerus and help with actions like swimming, hammering, and rowing.
Slim Goodbody will demonstrate the use of these muscles by operating this rowing machine.
That's it.
That's it.
No piranha, no head trauma.
No.
All right, we're finally getting someplace.
The muscles of the pectoral girdle include the pectoralis major, the latissimus dorsi, the deltoid, and the teres major. Also included in the group of pectoral girdle muscles are the rotator cuff muscles, which include the teres minor, the subcapularis, the supraspinatus, and the infraspinatus.
Oh, that was quite a workout.
I laced the handles of the rowing machine with an hallucinogenic agent. No, really, I did.
I'm calling my lawyer.
The muscles of the arm help move the forearm. There will be no demonstration of the use of these muscles, as Slim Goodbody now believes he has the body of a dragon and the head of Carl Lewis.
The muscles of the arm cross the elbow joint and insert on the forearm in order to move it. They are the triceps brachii, the biceps brachii, the brachialis of the arm, and brachioradialis of the forearm.
The muscles of the hip are the muscles responsible for moving the thigh. I will now demonstrate the use of the hip muscles by cautiously walking away from Slim Goodbody, who's slowly creeping up on me.
Hey, muscle boy, why don't we have a little chat?
The muscles of the hip include the iliopsoas, the sartorius, the adductor magnus, the adductor longus, the adductor brevis, the gracilis, the gluteus maximus, the gluteus medius, and the gluteus minimus.
Okay, now I'm gonna let you go. But first, we're gonna set some ground rules, okay? Okay. Now, the first thing, I wanna be sure
The muscles of the thigh move the leg. Now remember, the thigh and the leg are different. The thigh is superior to the leg. I will now demonstrate the use of these muscles by running from the madman who's trying to kill me.
I should have done the gig in Vegas.
The muscles of the thigh include two major groups. These groups are the quadriceps, which extend the leg, and the hamstrings, which flex the leg. The four muscles in the quadriceps group are the rectus femoris, vastus lateralis, medialis, and intermedius. The hamstrings are composed of the biceps femoris, the semitendinosus, and the semimembranosus.
The muscles of the leg move the ankles and toes. Normally, I would demonstrate these muscles, but if I move a muscle, Slim Goodbody will, what was that, Slim?
Turn your head into a salad bowl.
Okay, that's it.
The muscles of the leg include the tibialis anterior, the extensor digitorum longus, the peroneus, the gastrocnemius, and the soleus. Also included are the deep muscles of the leg. These are the flexor digitorum longus, the popliteus, the flexor hallucis longus, and the tibialis posterior.
Before we settle our differences man to man, how about an anatomical fun fact?
And now, an anatomical fact with the renowned yet slightly annoyed Slim Goodbody.
Did you know that the hamstrings got their names when butchers would hang up large pig tendons for smoking and curing? Now, normally this was only done with ham, but today I'm gonna do it to a smartass.
Are we learning or what?
Oh yeah. Can I just give one more helpful tip for naming muscles? Remember, for the most part, each muscle system is responsible for moving the structure below it. So, the muscles of the thigh move the leg, the muscles of the arm move the forearm, etc. And that's the muscular system. Simple, isn't it? Oh, and don't forget, you can always rewind the tape and review the names and locations of all these muscles so they stick in your head. Or, you can rewind the tape right now so that I don't get beaten up.
Wait, no!
Part 3, the nervous system. Now we're not going to be able to get anywhere until you turn your head and cough. Don't look at me like that. Hello. I'm a certified medical expert, and I've been hired to discuss the nervous system, provided the viewer has proper insurance.
Section A, Intro to the Nervous System.
The nervous system is like the control booth for your entire body. Every time you swat at a bee, every time you think poorly of your enemies, every time you eat a gummy animal and say to yourself, "By God, that's a delicious gummy animal," it all begins with your nervous system.
Am I being charged for this?
Yes. Now, the nervous system is made up of two distinct parts, the central nervous system and the peripheral nervous system. You know what that thing's for?
The central nervous system, or CNS, is made up of the brain and the spinal cord. The brain acts as a command center, sending messages to the body. The spinal cord acts as a courier and carries these messages. Basically, the CNS takes incoming sensory information. You know, stuff you hear, taste, and see. The CNS receives that stimuli, interprets it, and then responds to it.
The peripheral nervous system, or PNS, consists of structures outside the central nervous system, nerves that extend from and insert into the brain and spinal cord. Basically, the peripheral nervous system links the body to the central nervous system. We'll go into detail on both these systems in just a little bit.
In order to completely understand the nervous system, you have to learn about the minuscule building blocks of nervous tissue. There are two types of building blocks called neurons and supporting cells.
Neurons are the tiny structural units that make up the nervous system. They are specialized cells that conduct messages in the form of electrochemical waves called action potentials. Because we're talking about anatomy and not physiology, you don't really have to learn much about impulses and action potentials. Just know they exist.
Also, remember that most mature neurons can't undergo mitosis, meaning they can't reproduce. That means they can't be replaced if they're destroyed. So be careful. Brain damage is irreversible.
Neurons are large complex cells made up of a cell body with outreaching extensions, or processes. The cell body is like a base, an anchor for all the extensions. Every neuron has two different types of cell extensions coming out of its cell body. These extensions are the axon and the dendrites.
The axon is a single extension which can vary in length. The axon conducts impulses away from the cell body of a neuron and towards other cells. Dendrites are short, thick, branched extensions of the cell body. The dendrites receive and conduct signals toward the cell body. So, while the axons conduct impulses away from the cell body, the dendrites conduct impulses towards the cell body.
Now, the supporting cells are a whole different can of worms. The supporting cells are different from neurons. First off, the supporting cells are non-excitable, meaning they do not conduct impulses. Also, there's a lot more supporting cells in the body than neurons. In fact, there are 9 times more supporting cells than neurons. Yep, these babies comprise the bulk of nervous tissue, so they're real important. They basically support the neurons. If neurons are golfers, supporting cells are caddies. There are 6 types of supporting cells. 4 of them are in the central nervous system, and 2 of them are in the peripheral nervous system.
The 4 types of supporting cells of the CNS are called neuroglia, meaning nerve glue. There are 4 kinds of neuroglia. They are astrocytes, oligodendrocytes, ependymal cells, and microglia.
Astrocytes are the most common neuroglia. They're star-shaped, which should be easy to remember, because astro should remind you of outer space. The astrocyte's main job is to brace neurons and link them to blood capillaries, which are the neuron's main source of nutrients.
Oligodendrocytes are another type of neuroglia. Now, oligodendrocytes is a huge, complex word, but actual oligodendrocytes aren't that complex. In fact, they have even fewer branches than astrocytes. The main job of oligodendrocytes is to insulate neurons. They accomplish this by wrapping around fibers on the neurons to create a protective covering. This protective covering, made up of oligodendrocytes, is called the myelin sheath. We'll go into more detail on the myelin sheath later.
The microglia are small, sort of oval-shaped cells with long, thorny extensions sticking out of them. Their main job is to protect the central nervous system by attacking and engulfing invading microorganisms.
The ependymal cells are the last type of neuroglia in the central nervous system. These cells are shaped like columns and have tiny little fibrous extensions coming off them. The flipping and flopping of these extensions helps circulate the cerebrospinal fluid, which is liquid stuff that helps cushion the brain and spinal cord. But don't worry, We'll go into more detail on the spinal cord, brain, and cerebrospinal fluid later.
The neuroglia, unlike neurons, can reproduce. Great, right?
Right.
Wrong. These cells are the cells that, when they divide too much, produce brain tumors and cancers known as gliomas.
Bummer.
Yeah, but don't worry. When neuroglia reproduce at a normal rate, they're fine. So don't dwell on it. Just commit the 4 different types of neuroglia to memory and then move on to the supporting cells in the peripheral nervous system.
There are 2 different kinds of supporting cells in the peripheral nervous system: satellite cells and Schwann cells.
The satellite cells surround a neuron cell body and play a role in controlling its chemical environment.
The Schwann cells are the peripheral nervous system's version of the CNS's oligodendrocytes. Remember them? They're one of the 4 neuroglia. You remember how oligodendrocytes make up the myelin sheaths in the central nervous system? Well, Schwann cells do the same thing for the PNS. Just like oligodendrocytes, Schwann cells insulate the axons of neurons. When you put all of the Schwann cells together, the total sheath of insulation you create is called a myelin sheath. The myelin sheath increases the speed of an impulse traveling along the axon, kind of like how plastic insulation increases the speed of electricity through a wire.
If for some reason the myelin sheath is destroyed, impulse conduction deteriorates. This is called demyelination. This sort of deterioration occurs in demyelating diseases like multiple sclerosis.
Well, you've had a brief introduction to the building blocks of the nervous tissue. Now you can concentrate on learning about the anatomy of the 2 major parts of the nervous system, the central nervous system and the peripheral nervous system.
Section B, the central nervous system.
As you remember, the central nervous system is made up of the brain and the spinal cord. We'll discuss the brain first.
Can I go home now?
Hey, who's the doctor?
Anatomists argue all the time about how you need to divide the brain in order to name it. Well, you can argue from today till tomorrow, but no matter how you divide the brain up, the major structures within the brain remain the same. So for the sake of convenience, we've divided the brain into 4 major regions: the cerebrum, the diencephalon, the brainstem, and the cerebellum.
The cerebrum forms the superior or upper part of the brain and accounts for about 80% of total brain mass.
That's a lot of brains!
The cerebrum is highly convoluted. This means it has tons of folds and curves. These folds and curves are made up of elevated ridges of tissue called gyri and shallow grooves called sulci. One of the major areas of the cerebrum is the cerebral cortex.
The cerebral cortex is a thin layer that covers the cerebrum like bark covers a tree. The cerebral cortex is made up of something called gray matter. Gray matter is made up of cell bodies and unmyelinated fibers. Remember, unmyelinated means no myelin sheath. The inner area of the cerebrum is made up of myelinated axons called white matter. But within this white matter, there's also little islands of gray matter called basal nuclei.
The cerebrum is divided into a right and left hemisphere. Then each hemisphere is subdivided into 5 lobes. 4 of those lobes are named for the cranial bones that are located right above them. These lobes are the frontal lobe, the parietal lobe, the temporal lobe, and the occipital lobe. The 5th lobe is buried within the other lobes and is called the insula. So there are 5 lobes per hemisphere.
These cerebral lobes are responsible for our conscious behavior. First off, they're responsible for cognitive functions. You know, higher thinking like language and memory. These lobes also interpret stimuli and help us produce appropriate responses. This means that these lobes help us do things like read, write, and figure out how to build and defuse non-lethal bombs. Basically, without our cerebrum, we'd be worthless lumps, with no language skills, incapable of appropriate responses.
Y'all get that picture box out of my face, or y'all's really gonna get your what fors?
The next major part of the brain is called the diencephalon. Though the word diencephalon sounds like a dangerous space weapon or Greek deity, in actuality, it is a dangerous space weapon. Actually, it's the core of the brain and is surrounded by the cerebral hemispheres. It consists of 3 regions: the thalamus, the hypothalamus, and the epithalamus. All of these regions surround the 3rd ventricle, one of several fluid-filled cavities inside the brain, which is also known as a dangerous space weapon.
The epithalamus makes up the roof of the 3rd ventricle. It it might be helpful to remember that the prefix epi means upon. The hypothalamus provides the floor of the third ventricle, and funnily enough, hypo means below. And finally, the third ventricle is entirely surrounded by the thalamus. So without these other structures, the third ventricle, well, wouldn't be a cavity at all.
The thalamus is a solid egg-shaped structure that makes up about 80% of the total mass of the diencephalon. So you could say it's pretty big. The thalamus serves as a sensory relay station to the cerebral cortex. Without it, our five senses would be useless.
The epithalamus is posterior to the thalamus. It's involved in the regulation of the sleep-wake cycle because it contains the pineal gland, which produces the hormone melatonin. You'll learn more about hormones in the Anatomically Correct World of Anatomy Part 2. And, don't forget, the epithalamus also makes up the roof of the third ventricle. But you know that.
The hypothalamus is just below the thalamus, and surprise, surprise, it forms the floor of the third ventricle.
Is the hypothalamus important? Well, why don't you be the judge? The hypothalamus is responsible for controlling the autonomic nervous system, which we'll talk more about later. This means that the hypothalamus indirectly regulates heart rate, blood pressure, respiration, digestion, hormone release, hunger, thirst, emotions, and the libido, or sex drive. So without it, we'd have to tell ourselves when to breathe, when to eat, and when to buy dirty magazines. Can you imagine what the world would be like without the hypothalamus?
Okay, everyone, welcome. Welcome to Hype Suck Grow Up, the hypothalamus support group. Of course, we're here to get together with people who have trouble with or have lost their hypothalamus, and we're just getting together to help each other out. So let's start off things with Bob. Bob, why don't you tell us a little bit about your problem?
Well, that's been pretty rough since it... for a little of it. Damn hard. Since I lost my hypothalamus in the light bright accident, yeah.
Well, we feel your pain, Bob. Hold in there. We'll help you out. Okay, Linda, let's talk about your problem, Linda.
Can't talk. Breathe. And one.
It's pretty obvious that the hypothalamus, as well as its friends, the thalamus and the epithalamus, are important.
And so I say to the guy, goiter, I thought you said loiter. You be still. The brain stem is the next major region of the brain. It's located between the spinal cord and the diencephalon.
Can I have a piece of bread?
The brainstem helps out by controlling the heart rate and respiratory rates. It also houses the visual and auditory reflex centers that help us see and hear. It's even connected to 10 of the 12 pairs of cranial nerves that we'll give you the details on later.
The brainstem is made up of 3 different regions: the midbrain, the pons, and the medulla oblongata.
The midbrain is a short area located directly below the diencephalon, which you just learned about. The pons, meaning bridge, is inferior to or below the midbrain. And finally, the medulla oblongata is the section of the brainstem that is furthest down and blends into the spinal cord at the base of the skull. It also makes a great song lyric.
Medulla oblongata, Mr. Robata, medulla.
The cerebellum is the last major region of the brain we'll talk about. It's also the name of the company that produced this video, Cerebellum Corporation. The location and function of the cerebellum is best described in this commercial for our company, Cerebellum Corporation.
Cerebellum, helping you help yourself.
I founded Cerebellum when I was 8 years old. It was a dream of mine. I decided to name the company Cerebellum because cerebellum means little brain. Our company is a little brain with a big dream.
The cerebellum is located dorsally, or behind, the pons and the medulla, and separated into 2 hemispheres. Our building is located dorsally to a liquor store and separated into 2 warehouses. The similarities are pretty obvious.
The cerebellum is responsible for motor coordination, posture, and balance. All of the writers at Cerebellum are very balanced.
You ever dream you have claws?
There are countless similarities between the real cerebellum and our company. It's really pretty astounding.
Cerebellum, helping you help yourself.
It's what we do.
So that's the skinny on the cerebellum. It's located behind or dorsally to the pons and medulla oblongata. It's also responsible for motor coordination and balance.
You might also want to take a look at a structure that's contained inside the cerebellum called the arbor vitae. If you make a sagittal cut through the cerebellum, which is a vertical cut that divides it into two halves, you'll see a bunch of white branches.
These white branches are extensions of the myelinated axons in the white matter of the brain. The patterns these extensions make are called the arbor vitae. Arbor vitae means tree of life, but only its really close friends call it that.
Oh, there is one more tricky thing you should learn about the cerebellum. Even though the word cerebellum means little brain, the cerebellum actually makes up 11% of the total brain mass. It's the second largest region in the brain after the cerebrum. So commit that to your memory and you'll know all you need to know about the brain. The cerebellum, the cerebrum, the diencephalon, and the brainstem, they work together in perfect harmony.
Are you telling us that a structure as vastly complex and delicate as the brain has no form of protection?
Okay, you caught us again. The brain does have 3 forms of protection: the skull, the meninges, and a liquid cushion called cerebrospinal fluid. Now, we've already discussed the skull, but the meninges and cerebrospinal fluid are fair game.
The meninges are made up of 3 connective tissue membranes. These membranes cover and protect the structures in the central nervous system. You know, the brain and the spinal cord. The 3 meningeal layers, from the outermost one to the innermost one, are the dura mater, the arachnoid, and the pia mater.
Just like the land of the free, the brain needs protection, and these 3 meningeal layers we have are perfect for the job. And so, I give you the dura mater, the arachnoid, and the pia mater.
The dura mater, translated it means tough mother, and what a tough mother it is. It's leathery, double layered, and surrounds the entire brain. It also anchors the brain to the skull to limit movement. The dura mater, without it, the brain would be as defenseless as the Swiss.
Qu'est-ce que c'est avec vous? Laissez-nous tranquilles.
The arachnoid is the middle membrane. It's made up of loose connective tissue membrane and contains web-like extensions. That's how it gets its name. It's spidery, web-like, and wily. Without it, the brain would be as defenseless as the Canadians.
Ow! Quit shooting me. God, that hurts. God. Oh, knock it off, eh?
The pia mater is known as the gentle mother. The pia mater is the innermost layer. It is heavily invested with small blood vessels and clings to the brain surface. It is very dainty and delicate. The pia mater has no business being in the army.
Cerebrospinal fluid also protects the brain and is amusingly nicknamed CSF. CSF is a fluid found inside ventricles, which are cavities in the brain. It's also found in between the arachnoid and the pia mater. CSF cushions the brain, gives it buoyancy, buffers it from trauma, nourishes it, and removes waste products.
So, those are the many defenses the brain has for protection: the skull, the 3 meningeal layers, and CSF. Thank heavens for them, and that about wraps it up for the brain.
For those of you who want to study the electrical activity of the brain, why not try electroencephalography, or EEG? This is the tool doctors use to measure the electrical activity of brain waves. It's usually used to study sleeping disorders and epilepsy, but you can use it to explore the brain in the privacy and comfort of your own home.
Really?
No, probably not. The machines cost thousands of dollars, but you could sneak into a hospital and use one.
Really?
Not without being arrested. And we wouldn't want to be clubbed by a rogue police officer, would we? Why, that just might cause...
traumatic brain injury.
Even the bravest of soldiers fear a traumatic brain injury. These horrible injuries are the result of a direct blow or when the brain ricochets against the skull. There are 2 common types of brain injuries: concussions and contusions.
Concussions involve minor damage to brain tissue that doesn't result in permanent damage, but can cause dizziness.
Contusions involve tissue destruction and can cause permanent neurological damage. So let this be a lesson. Wear your Army helmet at all times.
even at the beach.
You should also be aware of a number of degenerative brain diseases, which are long-term disturbances in brain structure and brain function. Two serious degenerative brain diseases are cerebrovascular accidents and Alzheimer's disease.
Cerebrovascular accident is another word for stroke, or when a circulation blockage causes a lack of blood to the brain. This results in a condition called ischemia. Ischemia eventually results in the death of brain tissue.
Alzheimer's disease results in dementia, a breakdown of mental processing. This is a progressive degenerative brain disease, which means it gets worse over time. Tragically enough, the effects of brain diseases are irreversible because the neurons that make up the brain do not regenerate.
So now that the brain is our close and personal friend, we need to move on to the second section of the central nervous system, the spinal cord. The spinal cord connects the brain to the peripheral nervous system. It's also a major reflex center. This means it's responsible for reflex action, which is rapid response to any kind of stimulus. We'll go into more detail on this later.
The spinal cord is roughly 17 inches long and stretches from the large opening at the base of the skull, called the foramen magnum, all the way down to the first lumbar vertebra.
That's a lot of cord.
A number of spinal nerves extend out from the spinal cord, but we'll go into details on those later on.
Just like the brain, the spinal cord has a bony covering to protect it. This covering is the vertebral column, which, if you've been paying attention, you know is part of the axial skeleton. The spinal cord, just like the brain, is also protected by the cerebrospinal fluid and the meninges.
The spinal cord is also protected by the same three meningeal layers of the brain: the dura mater, the arachnoid, and the pia mater. The one exception is that the dura mater of the spinal cord is only single-layered and is called the dural sheath. So just remember that the dural sheath is different from the dura mater because it's single-layered rather than double-layered.
Some amusing and entertaining features of the spinal cord are the conus medullaris, the filum terminale, the denticulate ligaments, the cervical and lumbar enlargements, and the cauda equina.
The conus medullaris is the most inferior, tapered end of the spinal cord. The filum terminale is an extension of the pia mater that anchors the cord to the coccyx, or, to dumb it down, the butt bone. The denticulate ligaments attach the spinal cord to the vertebral column.
The cervical and lumbar enlargements are areas of the spinal cord that are wider than the normal diameter. The spinal nerves coming out of the cervical enlargement serve the upper limbs, and the spinal nerves coming out of the lumbar enlargement serve the lower limbs. Finally, the cauda equina, or horse's tail, is a group of nerve roots at the end of the spinal cord.
So that's the long and short of the central nervous system, the brain, the spinal cord, and a whole lot of worries. Knowing this, you should feel confident about moving on to study the peripheral nervous system, or PNS.
Section C, the peripheral nervous system.
Like we said before, the peripheral nervous system's main job is to link the body to the central nervous system. It accomplishes this job using two subdivisions, the sensory, or afferent division, and the motor, or efferent division. We'll start with the sensory division.
The sensory division has to do with your senses. That's how it got its name. Its job is to detect stimuli, stuff like pain and pressure, temperature and smell. After it does this, it transmits an impulse to the CNS, where the impulse is processed. The division contains 5 receptor types, which are classified by the type of stimuli they detect. These receptors are the mechanoreceptors, the thermoreceptors, the photoreceptors, the chemoreceptors, and the nociceptors.
The mechanoreceptors detect mechanical changes like touch, pressure, vibrations, and stretch. Mechanical changes usually involve some kind of physical stimulus. When you hear mechano, think mechanical.
Thermoreceptors detect changes in temperature. This is easy to remember because thermo sounds like thermometer.
Photoreceptors are responsible for detecting changes in light. Photo is another word for light, so you shouldn't have any problem memorizing this either.
Chemoreceptors detect soluble chemicals. When you hear chemo, think chemicals.
And finally, nociceptors are specialized to detect physical pain.
Now, it's important to note that your special senses are different from your general senses. Your special senses, vision and hearing, utilize really complex receptors that are housed in your sense organs. Your eyes and ears. We'll describe those in a little bit. But for now, concentrate on the general senses of the sensory division that we just discussed. These senses use things called reflex arcs to produce rapid programmed responses to stimuli. Confused? We'll explain.
Every reflex arc has 5 components: a receptor, a sensory neuron, an integration center, a motor neuron, and an effector.
Receptors, which we've already talked about, detect stimuli.
A sensory neuron transmits an impulse to the central nervous system.
The integration center is located in the CNS and processes and interprets the stimuli.
The motor neuron transmits an impulse from the integration center to an effector organ.
And finally, the effector organ, usually a muscle, responds to the stimuli by contracting. Like when a hammer whacks your knee, the effector organs, the muscles around your knee, contract.
So that's how the reflex arc works for the sensory division of the PNS. And luckily for you, the motor division is just as fun and exciting.
The motor division transmits impulses from the CNS to the effector organs and causes those organs to respond. So whereas the sensory nervous system transmits impulses to the nervous system, the motor nervous system transmits impulses from the CNS. The motor division can be broken down into 2 subdivisions, the somatic nervous system and the autonomic nervous system.
The somatic nervous system is responsible for voluntary control of skeletal muscles. So, every time you give a Swedish massage, every time you pet a dog, every time you raise your hands to fight against evil, that's the work of the somatic nervous system.
The autonomic nervous system is in charge of the involuntary action of smooth and cardiac muscles. So, the autonomic nervous system keeps tabs on involuntary regulation of organs, glands, and blood vessels. The autonomic nervous system can also be further broken down into 2 subdivisions, the sympathetic division and the parasympathetic division. We'll talk about the sympathetic division first.
I'm scared, Big Joe. Hold me.
Pull yourself together, Harry. It's time to be a man. I say we jump over these sandbags and get riddled with bullets for our country.
No, Big Joe, please. I just want to run and hide away in the forest with all the birds and trees
You're
and happy
talking
people.
crazy, man. You're talking crazy. I just want to run and charge at the enemy and take a surface-to-air missile in the face.
Hello, I'm a doctor.
Oh, that means that you could help us if we get injured in battle.
Oh, no. I have no real medical training. I've just been hired to play a doctor because my voice sounds learned and reassuring. You see, what you boys are feeling right now are the effects of the sympathetic division of the nervous system.
What?
Big Joe, you want to jump out and fight in response to the terror of battle. And Harry, you want to run in fear. This is what's known as the fight or flight response.
How does he know our names?
The sympathetic nervous system generates the fight or flight response in the face of exciting, adverse, or threatening stimuli.
How does he make those little pictures appear?
Oh, take one of these. What you're both feeling right now is an increase in heart rate, blood pressure, respiration, and blood flow to muscles. You're also experiencing a decrease in digestion to divert blood from the rest of the body for use in skeletal muscles. All this is done to prepare for swift and immediate action. That's the job of the sympathetic nervous system. So what's it going to be, boys? Fight or flight?
I regret nothing!
I think I'm going to go train a little bit more.
Kids.
The other section of the autonomic nervous system is the parasympathetic division.
So then I laughed in his face and shot him in the kneecaps. So where were you out there? I didn't see you.
No, Sarge. I was out there. I was just, I'm quick and wily like a rabbit. I was doing more of my own thing. But I'm really happy to be here now, safe and warm with you. Safe and warm.
You know, I killed 28 soldiers, 6 civilians.
Yeah, me too.
But now that I'm back here, I feel rested and at ease.
That's right, boys. Oh! Whoa! What you're feeling right now are the effects of the parasympathetic division of the autonomic nervous system. The parasympathetic division helps us rest and digest.
This is a restricted area.
You see, This division stimulates a gastrointestinal activity at a high level and also keeps heart rate, blood pressure, and respiratory rate at normal resting levels. And that warm feeling you're probably feeling on your skin right now is due to the fact that blood is no longer being diverted to your skeletal muscles and can flow freely to other areas. And that's the parasympathetic nervous system. It's really quite simple.
You've got 5 seconds to vacate the premises, quack.
Who wants lollipops?
Oh, man.
Kids.
So you can see the difference between the autonomic and somatic nervous divisions. The autonomic divisions control things you didn't even know needed controlling. So when you think autonomic, think autopilot. But there is one other key way in which the somatic nervous division differs from the autonomic nervous division. The somatic division uses only one neuron to link an effector organ to the central nervous system, while the autonomic division uses a 2-neuron chain.
You see, in the somatic nervous system, the cell bodies of motor neurons are located in the central nervous system. Their axons, the little branches that extend from the cell body, well, these axons extend into spinal nerves and into the skeletal muscles they serve. So they use only one neuron per chain.
The autonomic nervous system uses 2 neurons. The first neuron in that chain is called a preganglionic neuron. The cell body of that neuron is found in the central nervous system, but the preganglionic neuron is connected to the second neuron by a preganglionic axon. The second neuron is called the postganglionic neuron. The cell body of the postganglionic neuron is located in a ganglion, which is a collection of neuron cell bodies in the peripheral nervous system. Then, the postganglionic neuron is connected to an effector organ by a postganglionic axon.
So that's another basic difference between the autonomic and somatic divisions of the motor division of the peripheral nervous system. Now, we just went through a buttload of divisions and subdivisions, so let's take some time to retrace our steps through the peripheral nervous system.
The peripheral nervous system can first be broken down into the sensory division or motor division. Then the motor division can be further broken down into the autonomic and somatic divisions. Then the autonomic division can be divided into the sympathetic and parasympathetic division.
And there you have it. But why stop there?
Because we're tired.
Like hell you are. You're raring and ready to study actual nerve clusters found in all these different divisions of the peripheral nervous system. Yee-haw!
An important cluster of nerves in the peripheral nervous system are the 12 cranial nerves and the 31 spinal nerves. Cranial nerves arise from the brain.
There are 12 pairs of cranial nerves, and with the exception of the vagus nerve, they all serve the head and neck area. These nerves are numbered in order from their location in the anterior of the brain to the posterior of the brain. In other words, from top to bottom. They can be separated into 3 groups: the sensory nerves, the motor nerves, and mixed pairs, which are groups of sensory and motor nerves. The sensory nerves are labeled 1, 2, and 8. The motor nerves are 4, 6, 11, and 12, and the mixed pairs, sensory and motor, are 3, 5, 7, 9, and 10.
Welcome to Cranial Nerve Countdown, where we give you the cranial nerves in descending order. So, in descending order, here we go. At the top of the charts is cranial nerve number 1, the olfactory nerve. This sensory nerve is responsible for smell. Next up is cranial nerve number 2, the optic nerve. This is the sensory nerve that makes vision possible. Making its debut at number 3 is cranial nerve number 3, the ocular motor nerve. Then at number 4, the trochlear motor nerve. Both of these nerves are responsible for movement of the eyes. 2 weeks at number 5 is cranial nerve number 5, the trigeminal nerve. It's the largest cranial nerve and is responsible for sensation in the face and the muscles that help us chew. The abducens is cranial nerve number 6. This motor nerve is responsible for right to left and left to right eye movement. Nerve number 7, the facial nerve, is dedicated to Bobby and Juanita. The facial nerve is responsible for facial expressions and the secretion of saliva and tears. So don't cry, Juanita. Bobby loves you. This nerve is grouped with the mixed pairs. Next on the charts is cranial nerve number 8, the vestibulocochlear. This sensory nerve is in charge of equilibrium or balance and hearing. The glossopharyngeal nerve is number 9. It's responsible for swallowing and taste. The vagus nerve, number 10, is responsible for slot machine regulation. No, just kidding. The vagus nerve is actually involved in the regulation of heart rate, respiration, and digestion. It's even responsible for the muscles in the voice box. The vagus nerve is the only cranial nerve to pass beyond the head and neck and into the thoracic and abdominal cavities. That's quite a nerve. Cranial nerve number 11 is the accessory nerve. This motor nerve is responsible for head and neck movement and has won 4 Grammys this year alone. The hypoglossal nerve is cranial nerve number 12. It's found hiding underneath the tongue and helps us speak and swallow. And that's it for Cranial Nerve Countdown. Until next time, keep your nerves on the ground and keep reaching for the rewind button.
Another area of the nervous system that's jam-packed with nerves is the spinal cord. There are 31 pairs of nerves in the spinal cord that serve the body below the head and the neck. All spinal nerves are identified by the place they originate from along the spinal cord.
Altogether, the spinal nerves consist of 8 cervical nerves, 12 thoracic nerves, 5 lumbar nerves, 5 sacral nerves, and 1 coccygeal nerve.
And that brings us to the end of our little nervous system tete-a-tete. I hope you remember everything about the central and peripheral nervous systems, as well as their respective subdivisions. And if you find all this information to be a little hazy, just rewind. No need to get nervous.
All right, that is it, man. I am out of here.
I'd forgotten you were still here.
Yeah.
Well, that'll be $8,000.
8,000! Do you accept checks?
Mm-hmm.
Maybe my debit card.
Part 4, the special sense organs.
You know, a lot of people would argue that the ear is so closely related to the nervous system that it doesn't deserve its own section. These guys, for instance.
The ear deserves its autonomy.
No, it doesn't.
Liar!
Well, regardless of how you feel about it, we decided that the structure and makeup of both the ears and the eyes is so intricate that they deserve to be discussed individually. The eyes we'll learn about later. The ears we'll learn about now.
Section A, the ears and hearing.
The ear is made up of 3 separate regions: the outer ear, the middle ear, and the inner ear.
The outer ear can be separated into 2 subregions, the auricle and the auditory canal.
The auricle, which is sometimes called the pinna, is a shell-shaped outer part of the ear. It's made up of elastic cartilage covered in a thin layer of skin that contains oil and sweat glands. Sometimes the auricle is also covered with small hairs for protection. Ear hair can be an unfortunate necessity. The auricle directs sound into the auditory canal.
The auditory canal is a short, narrow chamber that stretches from the auricle to the tympanic membrane, or eardrum. The canal starts out as cartilage, but becomes bone when it approaches the eardrum. It's lined with skin and hairs and ceruminous, or earwax glands. These glands secrete cerumen, or earwax, that moisten the ear, trap particles, and prevent insects from entering, like in that horrible scene from Star Trek II. The auditory canal's most important duty is to conduct sound vibrations towards the eardrum.
The tympanic membrane, or eardrum, is the boundary between the outer and middle ear. The tympanic membrane is a thin, semi-transparent membrane. That means you can kind of see through it, but not so much that you can see naked people behind it. Sound waves that bounce off the tympanic membrane create vibrations that are relayed to the bones of the middle ear.
Love that vinyl sound. The middle ear, or tympanic cavity, is a small air-filled, mucus-lined cavity that looks kind of like this.
The middle ear is sandwiched by the eardrum and a bony wall. There are membrane-covered holes in this bony wall called the oval and round windows, which allow communication with the inner ear. There are also 3 bones found in the middle ear. The fancy science term for the ear bones is ossicles. They are the smallest bones in the human body. The 3 ossicles are the malleus, the incus, and the stapes.
The malleus is directly connected to the eardrum. A lot of people call it the hammer, because hey, it's kind of shaped like a hammer. You can remember this because malleus sounds like mallet, which is kind of like a hammer. The incus is the middle bone that connects with the other 2 ossicles. It's sometimes called the anvil because it's kind of shaped like one of those cartoon anvils that gets dropped on the heads of cartoon evildoers. And last, but not least, there's the stapes, or the stirrup. This is the bone that's connected to the oval window. The oval window is pretty much the gateway to the inner ear.
There is one other structure in the middle ear. It's the eustachian or auditory tube. Are you ready for some tube action?
The eustachian tube is a tube that links the middle ear with the throat. Now, the tube is normally flattened and closed, but sometimes, like when we yawn or swallow, it can open up to equalize pressure in the middle ear with atmospheric air pressure.
What a tube, huh? It blows me away. But don't get overly excited. There's still one final region in the ear, the inner ear.
Contrary to popular belief, Labyrinth is not just an underrated motion picture involving David Bowie, magic, and trolls. It's also another word for your inner ear.
The inner ear, or labyrinth, is the most complex structure in the ear. You can find the inner ear deep within the temporal bone of the cranium. It's divided into two regions, the bony labyrinth and the membranous labyrinth.
The bony labyrinth is a system of winding channels and cavities within the temporal bones. All of these channels are filled with paralymph. Paralymph is a fluid that, when set in motion, conducts sound vibrations.
Coincidentally, paralymph is so good at transmitting sound that in 1991, a concert hall in Opelika, Florida, was filled with paralymph to enhance the sound quality. The experiment was a success, barring the fact that all those who attended the concert drowned.
There are three regions in the bony labyrinth. These are the vestibule, the semicircular canals, and the cochlea.
The vestibule is the central section of the bony labyrinth. In this region, you can find the saccule and the utricle, which are two membranous sacs. The saccule and utricle contain little equilibrium receptors called maculae that help us keep our balance.
The maculae help us maintain static equilibrium. Static equilibrium is egghead speak for balance when you're standing still. The maculae are one of the reasons we can stand up straight without falling over.
The maculae also help us maintain balance while moving in a straight line, like when we walk or run.
The semicircular canal is made up of three regions that project from the posterior or backside of the vestibule.
Each semicircular canal is connected to the utricle by a semicircular duct. The semicircular duct is a membranous duct that's filled with endolymph. The end of each semicircular canal turns into a structure called the ampulla. The ampulla contain equilibrium receptors known as cristae ampullaris. The crista ampullaris responds to angular movements of the head and maintains dynamic equilibrium. That's egghead speak for balance in motion. Without the crista ampullaris, we'd be unable to keep our bodies balanced on a roller coaster or on one of those really spinny carnival rides. You know, the ones that spin, they spin around.
Another important structure of the bony labyrinth is the cochlea, which is a snail-shaped, bony chamber half the size of a pea. The cochlea extends from the anterior of the vestibule and coils for 2.5 turns. Inside, you'll find the cochlear duct, which is a membranous duct running through the cochlea. The cochlear duct extends into the membranous labyrinth, which we'll discuss later. It also contains the organ of Corti, which is actually the organ of hearing. It's filled with tiny hearing receptor cells called hair cells. It is a little-known fact that the famous organ in the cochlear duct isn't the only item that belongs to Corti. There's also the swimming pool of Corti, the mineral of Corti, and the ever-popular dental school of Corti.
Also contained within the bony labyrinth is the membranous labyrinth, another section in the inner ear.
The membranous labyrinth is made up of interconnected membranous sacs and ducts. These sacs and ducts are suspended in the paralymph of the bony labyrinth. These sacs are filled with a fluid known as endolymph, which also conducts sound.
So, that's the sum total of the ear. True, it may seem frightening hearing about all the structures inside the ear. Enormous swellings, snail-like coils, fluid. All this stuff inside that tiny space. But don't worry, you don't have to look at these structures every day. You just have to memorize them. So, rewind, review, and take it all in. And when you're done, look out for dangerous space weapons.
Section B, the eyes and vision.
Oh, yes. Oh, nice. Yes, yes, work that. Hello, I'm an ornithologist. I watch birds. I was watching birds.
Hey, come on, it's my turn. She's leaving the room.
Shut up! Shut up! I tend to use binoculars to enhance my vision. Not that the human eye doesn't do just fine on its own, far from it. The eye is great. In fact, you could say it's my second favorite organ. Why, without him, we wouldn't be able to see the curve of the inner thigh, or the curve of the inner thigh. Oh, give me those back. Ah. Hello, hot lady. Bird.
Basically, the eye is the organ that helps us see. Any idiot knows that. But did you know that the eye contains a bunch of photoreceptors that sense and encode patterns made by light? In fact, almost 70% of all sensory receptors are in the eye alone. Pretty impressive, huh? But don't worry about receptors just yet. We'll describe the anatomy of the eye in a little more detail first.
The eye is basically a hollow sphere, about 1 inch in diameter. It's made up of 3 layers. These layers are called tunics. The eye is also filled with fluids that are called humors, and then there's the third part of the eye called the lens. So the eye is made up of tunics, humors, and the lens.
We'll discuss all of these structures in detail, starting with the tunics. The 3 tunics of the eye are the fibrous tunic, the vascular tunic, and the sensory tunic.
The fibrous tunic is an outer coat of dense connective tissue. The fibrous tunic is different from other tunics because it's avascular, which means it has no blood vessels in it. There are 2 different structures in the fibrous tunic, the sclera and the cornea.
The sclera is a layer of white opaque tissue in the fibrous tunic. The sclera is the white area you see in the front of the eye and pretty much makes up the bulk of the eye's surface area. The cornea is a transparent bulge on the anterior or front part of the tunic. The cornea allows light to enter the eye.
The vascular tunic is the middle layer of the eye. The vascular tunic is highly vascularized, meaning there's a great deal of blood vessels in it. It can be broken down into 3 regions: the choroid, the ciliary body, and the iris.
The choroid is a pigmented membrane in the posterior or back part of the tunic. It feeds the eye, giving vital nutrients to all the hungry tunics. It also contains a brown pigment called melanin that helps absorb light.
The ciliary body is the anterior thick ring of tissue that surrounds the lens and controls its shape. We'll give you the details on the lens a little bit later.
The iris is the most anterior portion of the vascular tunic. It lies between the cornea and the lens. The iris is the visible colored part of your eye. You know, the part that draws compliments in a crowded bar. The iris is made up of smooth muscle fibers, and it can adjust the size of its pupil to regulate the amount of light that enters the eye. The pupil is the central opening in the iris that allows light to enter the eye. When you're looking at something really close or really brightly lit, the pupil is constricted to limit light levels. With distant vision or really dim vision, the pupil opens wider to allow more light into the eye.
The deepest and last layer in the eye is the sensory tunic. The sensory tunic is sometimes called the retina and is double layered. Those 2 layers within the sensory tunic are called the pigmented layer and the neural layer.
The pigmented layer is full of pigmented cells that absorb light, destroy foreign particles, and store vitamin A, a vitamin desperately needed by photoreceptor cells.
The neural layer is an inner transparent layer made up of millions and millions of photoreceptors that convert light energy into nerve impulses.
The neurons in the neural layer make vision possible. These neurons come in 3 great tasting varieties: photoreceptors, bipolar cells, and ganglion cells.
Adjacent to the pigment layer are the photoreceptors. When light triggers changes in these receptors, this produces a current that sparks the bipolar neurons into action. There are 2 types of photoreceptors, cones and rods.
Cones are photoreceptors that operate in bright light and provide sharp color vision. There are 3 kinds of cones: blue, red, and green. When these cones are stimulated in different combinations, we see different colors. Kind of like when you mix red and blue paint, you get purple. A whole bunch of cones are located in an oval region called the macula lutea, or yellow spot. And within this area there's a spot called the fovea centralis, which is a tiny pit in the center of the macula lutea that's nothing but cones. We use this area for really sharp focus, like when we're looking at something really small.
Rods are the other type of photoreceptors. We have more rods in our eyes than cones.
Rods are found on the outskirts of the neural layer. Rods respond to dim light and are responsible for gray tones and less defined vision. This is why, in really dim lighting, we can only see in shades of gray.
Another type of neuron in the sensory tunic is the bipolar cell. These cells receive input from photoreceptor cells and transmit the input to ganglion cells, and that's about it.
Ganglion cells receive electrical input from bipolar cells. When ganglion cells receive input from bipolar cells, they generate what's called an action potential.
The action potential is transmitted as a nerve impulse through the axons of the ganglion cells. All of the ganglion cell axons bundle up to form cranial nerve number 2, or the optic nerve. The optic nerve exits the eye at the posterior or back wall through an area called the optic disc.
The optic disc is also known as the blind spot because it doesn't contain any photoreceptors, so light focused at this area can't be seen. But fortunately, our brain fills in the visual info that our optic discs emit. So even if someone were to throw a grenade directly at my optic disc, Mother of God.
Oh yes, work it. Work it, work it, baby sparrow. Flap your wings to freedom. Hello. I'm still bird watching. I'm still using my eyes. Oh, quit looking at me like that and try to learn something about the humors of the eye.
Like we said before, the humors are fluids contained in the eye. They are the vitreous humor and the aqueous humor.
The vitreous humor is a clear gel located in the back, or posterior segment of the eye. The vitreous humor helps transmit light to the sensory tunic. The vitreous humor also helps maintain pressure within the eye that counteracts the constant tugging from eye muscles. One important tip to remember is that the vitreous humor is formed during the body's embryonic stage, way before we're born. It can't be replaced, so don't let just anyone mess with your vitreous humor.
Hey, I'm I Gunk Eddie of I Gunk Eddie's Eye Emporium, and now for a short time I'll remove anything from your eye for only $19.95. We pick, we scrape, we poke, we prod, we remove lint, dust, splinters, metal shavings, chunks of meat, crumbs, glass, sawdust, midgets, paper, dried skin, sand, evil spirits, anything, all for only $19.95. It's cheap, it's easy. Destroy your vitreous humor today.
The other humor is the aqueous humor. The aqueous humor is a fluid found in the anterior segment of the eye. The aqueous humor supplies nutrients and oxygen to the lens and cornea and removes waste products.
The aqueous humor is formed and drained continuously throughout life via the canal of Schlemm, which is located where the cornea meets the sclera.
Some say the Canal of Schlemm was discovered and navigated in 1908 by the intrepid explorer Alex Schlemm.
Onward, men! The iris beckons!
But this has never been proven. Now, if drainage of the aqueous humor is blocked, pressure within the eye increases. This causes compression of the retina and optic nerve, which leads to a condition known as glaucoma. And unless glaucoma is detected early, it can result in blindness. So see your doctor regularly and have your eyes checked out.
The human eye also has a lens. Listen.
The lens is a biconvex, transparent, flexible structure whose shape can be altered for precise focusing of light on the retina. You see, as we get older, the lens becomes larger, denser, less elastic, and more convex. This leads to vision impairment because the lens can't focus properly.
Well, that's pretty much the lens in a nutshell. You understand? Oh, you do. Good. What's that? Oh, you'd like to take me out to dinner. Well, I'm flattered, but, you know,
Who are you talking to?
I'm a doctor.
Have you ever wondered why some people are nearsighted and some are farsighted? These problems are called imbalances of refraction and have to do with the transfer of light from the lens to the retina.
For instance, when a person has an elongated eyeball, light focuses just short of the retina. This causes a condition known as myopia or nearsightedness.
People with myopia can see things that are close up really well, but things that are far away are blurry. This problem can be corrected by using concave corrective lenses.
When light is focused behind the retina, hyperopia or farsightedness occurs.
People with hyperopia have a hard time seeing things that are close to them, but can easily see things that are far away. Hyperopia is caused by a short eyeball and can be corrected by using convex corrective lenses.
No! No, it's not a felony. Listen, if the police come, we'll just tell them that we're freelance spies or something. Hello? How about I tell you a little bit about the accessory structures of the eye so that you might forget that I am a pervert?
Okay, the purpose of the accessory structures of the eye is to protect the eye from debris, infection, and just plain drying up. There are common accessory structures that you hear about all the time, like the eyelids and the eyebrows, but you hardly ever hear about things like the conjunctiva or the lacrimal gland. The conjunctiva is a layer of mucous membrane that covers the inner surface of the eyelid and the white part of the eye's surface. Bet you didn't even know it had a name, huh? And then there's the lacrimal gland. That's the thing that produces tears and lubricates the eye.
Bet you never knew about the lacrimal gland. Why, without it, we wouldn't be able to cry at, say, the beauty of the inner thigh. Oh, well, I've done enough teaching and bird watching for one day. Take care of your eyes.
You get down from there.
And your eyes will take care of you.
Part 5. The end.
Well, that's it. I feel a deep sense of nostalgia mixed with relief and hunger as we come to the end of this tape. We've talked about a lot of stuff. Bones, muscles, nerves, the brain, and still there's much to be learned.
It's true. If you want to learn about other systems like the cardiovascular system, the digestive system, or the reproductive system, you'll have to buy the Anatomically Correct World of Anatomy Part 2.
And if not, best of luck. If you have any questions, just call us at 1-800-238-9669. We'll see you all soon.
Real soon.
Bye-bye.
Wow, that was great.
That there's funny, like the moonshine and tool shed.
You said it, man. We learned about the skeletal system, both the axial and the appendicular skeleton.
Them dry bones worth a nickel in sore time.
We found out how to name the muscles and what they do, and then we broke down the nervous system.
That there Slim Goodbody, he's a hoot. He's like, he can stomp two snakes with 2 feet in a bucket, too.
You got that right, Enos. And we didn't even have to cut anybody up.
What about the digestive system and the reproductive system and such?
Well, I assume we'll just have to watch the Anatomically Correct World of Anatomy Part 2.
I got a better plan. Let's look at some guts.
Mom?
Hello, dear.
I've been working at the Cerebellum.
You now understand the carefree, wonderful, no-strings-attached worlds of the femur, the you. La, 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 la.
People often ask me why I work at the Cerebellum. No.
Yay.
Well, it shouldn't be that hard to avoid liver.
That one was for me. In 20 years, we'll look back and laugh.